Pharmacogenomics is the buzzword, and it's a big word in the media right now. And if you break apart pharmacogenomics, you think about it as pharmacy and genetics, and pharmacy being the medications that we take for all sorts of different conditions every single day, whether it's blood pressure, high cholesterol, whether it's diabetes, depression medications, and so forth. We're mapping those and trying to best understand how they're metabolized through the liver and other different pathways. So what we're doing is we're taking a simple blood sample, and so your provider will order this clinical laboratory test for you. You have a blood sample drawn. If it's difficult to obtain a blood sample, we do have other steps that we could take, such as a cheek swab, and then we will look at your particular DNA from your blood, and from that the laboratory will give us the results. We come up with a specialized recommendation list, and it will literally have a color report that has columns for green, yellow, and red with use as directed, the cautionary group, which might have more risk of drug interactions or more adverse effects, and then the red group, which we're significantly more cautious with, that maybe the doctor needs to increase the monitoring. Maybe it's best to avoid that medication altogether and find one that would be a little bit easier for you to use and better tolerated. So we do the testing right in Sioux Falls at the Vera Institute for Human Genetics. So if you are tested anywhere in the Vera Health System by blood or by cheek swab, that sample comes by courier to our lab, just like if you're having a blood count done, if you're having labs done before you go to surgery. Those labs get processed, brought out to us at the Vera Institute for Human Genetics, and we do all the clinical work right there too with our clinical specialized team. The insurances that are maybe a little more innovative and willing to talk on a one-by-one basis and do the prior authorization for this, we're willing to pay in those unique situations. It was well over $1,000 previously. We've taken that price point down by continuing to maximize efficiencies in our laboratory as well as with our clinical team, so that it's at a much more affordable price for the general healthcare consumer and patients. It is very much, the patients a lot of times are their own advocates and saying, hey, I've tried now these 3-4 medications, I'm still not feeling that great of benefit, but I heard about this story and I'd really wonder what your opinion is, and do you think this would be a good test? And so they can discuss it with their physician. They can say, hey, here's what's happened in the past, let's try this test, which will help narrow down our choices and best kind of target the next best medication. And so we really, at Vera, we try to do our absolute best to give people all the options, all the support with that holistic approach of mind, body, and soul. So let's not make it so we have this great technology available, but you can't afford to have it. So we're really trying to make it affordable, accessible for all of our patients, whether you're being seen at primary care or with psychiatry here at behavioral health. I would definitely recommend talking to your physician, whether primary care or psychiatrist at Vera. But if you want to just call our laboratory and talk to our clinical team, you can call us at 605-322-3050. And we'd be more than happy to help you and discuss with your physician. If you're unsure how to talk about the test, feel free, just reach out to us.